And a good Saturday morning to you. Welcome once again to Health Matters with Dr. Jim Warner of Warner Chiropractic, located at 4855 East State Street in Rockford, Illinois, in the Manhattan Plaza. It's enough to make you cry. It's enough to make you sigh. Sciatica. That's today's topic.
Yes, it is, Fred. And people actually do cry when they come in the office with sciatica.
I believe it.
So that was a true statement of what you had made. Sciatica, Fred, that is a term that describes pain going down the sciatic nerve, or the nerve that goes down the leg. And this nerve is actually the largest nerve in the body. And most people don't realize this, but the sciatic nerve is about the size of your thumb.
So it's big.
It's very, very large. And most people think of nerves, well, they're microscopic and, you can barely see them. Those are nerve endings. When the nerves come out of the spine, they're very large. They're probably about the size of a pencil. But when you've got 4, 5, or maybe even 6 nerves coming together, and that's what the sciatic nerve is. It's actually 5 or 6 nerves that are joined together to form one big nerve. It's actually the size of your thumb. So it's something that is very easily injured because of that.
That runs down both legs?
That goes down both legs, and it goes all the way down to your tip of your toes. So when people have pain in the feet, pain in their toes, burning, going down their legs, that is called sciatica.
You can feel that in the back of your knee sometimes.
You can feel it there. You can feel it in the calves. And sometimes there's a progression. When people come into my office, they'll say, well, it started hurting in my thigh, and then it went down to my knee and my calves, and now it's all the way down to my feet. And so when we treat that, Fred, interestingly, it kind of goes back the same way that it came. And so it takes a while for this to heal. Sciatic pain starts in the low back. And so you pinch the nerve in the lower back, and it goes all the way down the leg. When you start treating the lower back and you take the pressure off that nerve, it may still take weeks before it heals, because that nerve has to heal from the lower back all the way down to the foot.
And it causes some inflammation too, doesn't it?
Oh, definitely. And a lot of times when patients are coming in and they have low back pain and sciatica, and we start treating them, then they say, well, my low back is feeling pretty good now, but I'm still getting that pain down my leg. And the reason is, Fred, because it takes time for that nerve to heal.
Now, the nerve pathways, we've talked about this before, they go all over your body, and you can have a problem in one place but feel it in another place.
Absolutely, and sciatica is like that, and so is when there's pain going down your arms, which is very similar to sciatic pain, and it's actually coming from the neck. And people feel it in their hands, and they might have carpal tunnel syndrome and such, and there's a neck component of that, or the nerves from the neck that form the brachial plexus. That's just like the sciatic nerve. We could call that the sciatic nerve of the arm. The brachial plexus can give you the same type of symptoms as the sciatic nerve.
Now, something else, I know that sometimes heart patients who have problems, perhaps the beginning of a heart attack, will feel pain in their arms as well. So
absolutely,
if you get a pain like that, it's important to get checked out quickly.
It certainly is, and that's because the nerves to and from the heart go to the spine, and that same nerve then goes down the arm. And so you can feel pain and numbness or tingling in the hand, and there's nothing wrong with the hand. It's actually coming from the heart.
I've talked to people who've been relieved. They've been checked out because of pain like that, and it turned out it wasn't a heart problem, but it's always wise to get it checked.
Yes, and then a lot of times they'll say, well, the heart was okay. They just said it was your nerves. Well, that means you need chiropractic treatment, because it's the nerve that's involved and not the heart itself.
Is this an acute pain or just kind of a dull, aching type of pain?
It can be both. It can be both. So acute pain, sometimes people come in and it's intense. It hurts. It just started. The pain started in my back and it's just going down the leg. Or maybe they'll just say, I just feel it in my leg. It doesn't hurt in my back. I just feel it in my leg. And yet it's coming from the lower back. It can be a chronic thing that people have had for weeks and months. It's just a dull ache going down the leg. Again, that's a pinched nerve in the lower back, and we call it sciatica.
And how do you make the diagnosis to be sure that's what the problem is?
That's a good question. Well, one of the things that we do, Fred, is take x-rays, and we can actually measure the holes that the nerves come out of. And so we can see if a nerve's getting pinched or not. that might be causing it. Another thing we can tell, Fred, is if it might possibly be disc involvement. In other words, the disc or that cushion between the vertebrae can actually be bulging and pinching a nerve that goes down the sciatic nerve. So it can be a disc involvement. We need to check that out to see if that's it. It can even be, Fred, what we call a facet jamming. We've had a program before that we called facet syndrome, and that's when the bones are kind of in extension and they're actually pinching against each other, and there's just inflammation there. That can cause it. And then another thing that causes it, Fred, is the piriformis muscle, or the muscle that's right behind your gluteus maximus. It's a muscle that's in the hip, actually. The nerve goes through that muscle, and when that muscle goes in spasm, that stretches that nerve, and that causes sciatic pain also.
Would you be able to tell that by how tight that muscle is?
Yes, and that's what we do just by palpation. You can actually stick your finger or your thumb into the buttocks area, and that person will jump off the table if that's what it's from. And so we actually want to treat that muscle also.
They need to come back, though, if they jump off the table.
Yeah, and that tells me maybe I'm pushing my thumb in too hard. But I'm very gentle on that. But when you're doing that, that's how you find out if it's from the muscle. We've talked about sacroiliac involvement, where the sacrum or the part of the back that connects to the hip bone, a lot of times that is involved, and that piriformis muscle comes off the sacrum, and that bone in the lower back, and goes to the actual leg bone or the femur, and so it can be causing problems in the sacrum area, or the lowestmost part, or it can be even in the hip itself. You'll feel it in both places, and that goes along with the sciatic pain.
Now, if there's some inflammation causing the pinching, how do you work on getting rid of that?
Well, interestingly, Fred, you want to put ice on the lower back, because even though they're feeling the pain down the leg, you want to treat the cause of the problem, and that would be the lower back. So ice to the lower back sometimes helps sciatic pain. One of the things that we do in the office that works phenomenally well is acupuncture treatments. In other words, we do the chiropractic adjustment to try to take the pain or the pressure off the nerve, but since it still takes a while for that to heal, we'll place acupuncture needles in specific points in the leg, and the patients respond much, much quicker. It's almost like if you increase the electrical flow of the body, the natural electricity of the body, it causes the healing to take place much quicker.
So that affects the nerve pathways.
Yes, that definitely affects the nerve pathway, and that's why we place acupuncture needles on specific points. It may not even be where the pain is, but it's a specific point that affects the healing. Another thing that we might do, Fred, if it is a bulging disc that's pinching that nerve, we might put them in certain types of traction, or what we call disc traction, that actually pulls that bulging disc back into a more normal position, taking the pressure off the nerve.
Now, I know that in terms of inflammation, that you like to stay away from, the drugs, whether it's Aleve or something like that,
right?
And you prefer to use a treatment that will attack the real problem, get to the real problem. But what about nutritional types of things that will reduce inflammation?
Well, one of the things that seems to help, Fred, is digestive enzymes. Bromelain and some of these things actually help reduce inflammation too. So sometimes digestive enzymes, things that help your body digest food, is a natural anti-inflammatory. And so that would be good. When someone's in an acute phase of this where it's really bad, I'm not against taking non-steroidal drugs to help that over the hump, so to speak. So,
but just not continually.
Yes, don't take them for more than a week or anything. It's just something to get by until you get to the cause of the problem and get that fixed.
I know that you have a website where you have more information on this type of thing.
Yes, that's www.warnerchiro.com. People can just contact that and check the web, and we've got lots of information on low back conditions, sciatica, and acupuncture, and that sort of thing. So we cover that pretty closely.
I know that in my emails I get from you, you give information on a different thing every so often, perhaps once a month.
Yes, we do. And actually, we have a biweekly newsletter that goes out through the internet. If people would be interested, they could contact our office and give us their email address, and we'd be glad to send them this newsletter that like you said, describes certain conditions on a biweekly basis. We do that. So that would be interesting. One way, Fred, that people can tell if they got sciatica is if they're lying down and they raise their leg up and it hurts their back. That's sciatica. Now, if you can bring your knee up to your chest and that doesn't hurt, that won't tell you that that's sciatica. But if you got the leg straight and it hurts, then that is telling you definitely it's sciatica.
So that's one quick way to make a diagnosis.
Because that stretches that nerve when you keep the leg straight. See, when you bend your knee and you bring your knee up to your chest, if it's a mechanical problem in the back, that might hurt the back. But if it's just the sciatic problem, when you keep the leg straight and raise it, the back is moving the same. But if it hurts then that's telling you you're stretching that sciatic nerve. It's being pinched, and then you stretch it more because your leg is straight, and that'll give you a definite diagnosis of sciatica.
Well, speaking of that type of thing, are there any exercises that wouldn't be too painful that would help people with this condition?
Well, really, exercises don't help this because you got to get to the cause of the problem. Exercises that don't stretch the nerve might help somewhat. So when people have a problem with this, we might put them on a program where they pull their knees up to their chest or something like that with their legs bent, and you can put movement in the spine and it won't irritate the sciatica.
But this is definitely a problem that is treatable, and eventually you can see people healed from this.
And they can contact us by the web to get the information, or if they'd like to call us, we've got an interesting pamphlet on sciatica that might be very helpful to people.
All right. Well, we've all heard about the sciatic nerve. Now we know a little bit more about it. That phone number is
area code 815-398-8111, or they can contact us at www.warnerchiro.com.
And that's at Warner Chiropractic, located at 4855 East State Street in Rockford in the Manhattan Plaza. Thank you so much, Dr. Jim.
Thank you. Have a wonderful weekend.
That's going to do it today for Health Matters.